The COVID-19 vaccine booster is now expected to be recommended for all Americans after previously only being suggested for those immunocompromised. U.S. experts are expected to recommend the booster for everyone 8 months after they receive their second dose of the shot. Health experts say this will help as the Delta variant continues to spread throughout the country.
So with that said, this morning we're going to take a closer look at the spread of the Delta variant throughout our community over the past month and also the impact it's had on our medical system. So according to the Indiana State Department of Health, almost 83% of COVID cases this month have been from the Delta variant, which is up 7% from the month of July. And as Delta cases have spread across the country, they've pushed our hospitals back into overdrive. In some southern states, hospitals are beyond their capacity now. The Houston area is out of hospital beds, and there were 600 people on a waiting list for a bed as of Sunday.
Wow. We have our nursing team and our physician teams getting stretched thinner and thinner to take care of all the COVID patients that are throughout the hospital and our ICUs right now.
So this surge of cases and straining of our medical system is the context for the quicker talks among health experts for those COVID booster shots. So with that in mind, here's a look at our current situation in our hospitals. This first graph I'm showing you shows the ICU patients in Indiana. You'll notice how at the beginning of July, we were basically almost bottoming out with numbers. That was around the time when a lot of us were hoping we were getting to the other side of this thing. But we're also starting to hear about Delta's spread in other places. So as it has spread throughout our area, it's also brought back serious illness. Through late July and early August, we've seen this pretty steep climb in Indiana ICUs. We had 368 people as of this weekend. Here's a look at COVID patients in hospitals in Jefferson County since the beginning of July. Similar trend. As of July 2nd, there were 25 people in the hospital with COVID in Jefferson County, but it's climbed dramatically since then, particularly in early August. And this past weekend, we had nearly 250 people in the hospital in the county. So that's 10 times as many. And that's why some health experts are saying that even if we do the right thing and we push towards herd immunity through vaccination, we'll still have a lot of surge ahead of us.
Even everyone got vaccinated today, this surge would go on as it is right now for the next 4 to 6 weeks.
It's still important to know that getting everyone vaccinated who can be is still by far our best course of action, according to doctors. Even though we're seeing some breakthrough cases, the vast majority are mild, and the vaccines are still showing to be highly protective against severe cases, hospitalizations, and deaths.